We've all had it. That strange tingling when a limb falls asleep. Annoying, but harmless, right? But what if that numbness on one side of your body isn't harmless? What if it's the first sign of a stroke? A stroke is just one possibility. These feelings are your body's silent alarm for a host of serious conditions. The greatest danger? Most people just ignore them, assuming the sensations will simply fade away. Now, we will reveal what these feelings mean, what's happening inside your body, and the cost of waiting. First, a foot falling asleep from sitting is temporary pressure. The danger signal is when it's persistent or painful. This isn't a problem that fixes itself. It's neuropathy, and it's progressive, like a slow-burning fuse. This begs the question, why does the pain feel so real, even with no visible injury? The answer is a malfunction. Another myth. This only affects your hands and feet. It starts there, but can creep up your limbs, even affecting organs. Allowing this to advance leads to severe outcomes: permanent nerve damage, chronic weakness, and loss of simple abilities. So we know it gets worse. But to understand the true danger, we must look at the mechanism behind the pain itself. We asked why the pain feels real. The answer is central sensitization. Your nervous system becomes rewired. Your body starts creating pain from nothing, or turns a light touch into a burning feeling. The volume is stuck on high. Scientists can see this at a microscopic level. Connection points on spinal neurons grow in size and density. This confirms the pain is real and has a physical basis, even when doctors find no external cause. It's a biological process. Now that we know how the damage creates these sensations, let's look at what is causing the damage. For millions, the answer is sugar. High blood sugar is toxic to nerves, and tingling is often the very first sign of diabetes. Another major cause: your own immune system attacking your body. Conditions like MS and lupus all target the nerves. Infections can also leave damage behind. Shingles, Lyme disease, HIV, and even COVID-19 are linked to neuropathy. And sometimes the cause is physical, like a herniated disc, or a severe deficiency in vitamins like B12. The list of potential causes is vast, which makes a professional diagnosis so vital. But other truths are surprising. Think this is just a problem for older people? Think again. Doctors see a sharp rise in adults in their 20s and 30s. This is driven by modern factors: undiagnosed diabetes, poor nutrition, and a rise in autoimmune disorders. Getting a diagnosis can also be tricky. An MRI for a trapped nerve might come back clean, showing no structural cause. This is because an MRI sees structures, but can't see nerve damage itself. Specialized tests like an EMG are needed. This condition is not rare. It affects up to 1 in 6 adults. When it's ignored too long, the consequences are life-altering. The endpoint of this damage is not just pain. It's the complete loss of sensation. This is where the danger skyrockets. Recall how we started, with the simple act of ignoring a tingle? That leads here. You can't feel a cut or a burn. An unnoticed cut gets infected. The infection can spread to the bone. This is a primary pathway to amputation. Let's trace the path. A dismissed tingle becomes neuropathy. This creates chronic pain and total numbness, leading to injury. This outcome is terrifying, but it is not inevitable. The entire chain of events can be stopped at the very first link. The pain, the numbness, the burning. These are not minor inconveniences. They are vital messages from your nervous system. The outcome depends almost entirely on identifying the root cause and getting prompt treatment. Early action saves nerves. If you experience these symptoms persistently, do not wait. Do not explain them away. Make an appointment with your doctor. Ignoring the pain nobody sees won't make it disappear. Listening to it could save your mobility, your health, and your life.